Now I want to talk about barrier toward adoption evidence-based nursing practice in Malaysia. Firstly, the barrier is insufficient of knowledge about evidence-based practice among nurses. This is because of nurses having had no previous training in evidence-based practice, and also lack of clear guideline for doing research, and also affected by other problem also. And then nurses also have difficulty interpreting research report due to lack of understanding of some terms that used in research article. Insufficient of time, one of the barrier to nurses to adopt evidence-based practice. This is caused by overwhelming patient workload, and this lead the nurses do not have time to read research or implement new idea. The research report not readily accessible, especially in the internet. This is because of lack of internet to access for online information. Next, a study conducted by Lai, Teng and Li 2010 in their study stated that lack of good information technology support in the world one of the barrier to adopt evidence-based practice. For example, computer with no internet. From that, nurses unable to access online information, especially about evidence-based practice that related to the nursing care that give to the patient. Nurses also lack of commitment to improving and change their practice. This is because of nurses already influenced by other nurse, especially by a senior nurse, to practice the old way that do not have evidence-based practice. When nurses do not have commitment to change their practice, and this can affect the care that deliver to the patient. In addition, poor administrative support also one of the barrier to perform the evidence-based practice in nursing. This is caused by lack of incentive for nurses to pursue advanced education or engage in research. For example, if ward level manager do not support their subordinate to acknowledge evidence-based practice, evidence-based practice cannot be achieved. Other barriers including lack of awareness among nurses about evidence-based practice. This is because of nurses' lack of educational preparation, and they do not have motivation to search and apply the evidence-based, especially about nursing.